In Hamilton today, about 60 demonstrators gathering in front of City Hall to protest the Ford government's decision to close supervised drug consumption sites across the province. Julie Sharp was at the protest and joins us live with more. Julie.
Good evening, Matt. Earlier today, chalk lines were drawn during a DIE protest. The group says they want to bring attention to what they call preventable, predictable deaths due to the closure of supervised consumption sites. Earlier today, a die-in was held for about 20 minutes outside City Hall. Dozens of people were on the ground, outlines drawn around them. The crowd included frontline workers as well as family and friends and those who have lived experiences with drug use. Among those advocating was Kimberly Ritchie, who says she's coming from a background of drug use.
So I'm a person with lived experience, so I spent 15 years on these streets. Me sharpening syringes on mat packs to make them work, to keep the tips on them, me breaking tips off in my body, the flesh-eating bacteria like MRSA that ate away at my leg. All of it, the blood clots that prevented me from having children, all of that was preventable if I had access to a safer use space.
Jamal Pierre says he's been around people who use drugs. He says closing the sites will have a negative impact on the community.
We all kind of go through it together, and any loss that's preventable is super important to be able to take care of. And I think closing these sites is really condemning a lot of people to a darkness that we didn't want to see before, and that's going to be a lot more prevalent in the future. And that's a future that really scares me.
The organizer, Tess Hopkins, says she hopes the provincial government hears today's message.
I would hope that it forces our political leaders to listen to people with expertise, in particular people that use these sites, that use substances, that are the experts when it comes to overdose response.
Back in August, the province announced that supervised consumption sites within 200 meters of schools and child care centers will be shut down by March next year.
That doesn't work, folks. I know. I've dealt with it within our family. I've dealt with it within our community. That does not work. What works is rehab, detox beds, supporting these people with good paying jobs. Housing is absolutely critical.
In a statement to CHCH News today, the Ministry of Health said it's spending $387 million to create heart hubs, saying the hubs will reflect regional priorities by connecting people with complex needs to comprehensive treatment and preventative services, including mental health services, addiction support, primary care, and supportive housing. Chelsea Kirkby with the YWCA of Hamilton says there is a misconception that supervised consumption sites don't work. She says the government should be increasing the amount of supervised consumption sites instead of closing them.
For those that think that maybe they're not working or they're even contributing to a problem, that's not the case. We know that we serve hundreds of people a year in Hamilton through these types of services. And
she says supervised consumption sites do more than just provide a place for injections.
Overdoses are reversed. Folks are able to access health care, counseling, different services that will help support their well-being.
The group says they will hold these protests and die-ins with their allied groups for as long as necessary or until the closure decision is reversed. There was also a similar protest done at Queen's Park earlier today.